I wanted to know if you had any success stories. I'm curious if how successful is surgery in the brain? I personally don't know many patients that have had brain surgery. Many of the brain mets patients I work with have radiation therapy. So I just wanted to know if you had any success stories and how successful these surgeries are in the brain.
Yeah, so I think it's important to recognize that the field has changed a bit, really even in the last 10 years. When I was in training, which I won't date myself here, but wasn't all that long ago, it was a knee jerk on in neurosurgeons to kind of send folks with brain metastasis for radiation. And not too long ago, the only real form of radiation that people got was whole brain radiation, which is now kind of a bad word in the brain metastasis realm. Now there are more advanced radiation techniques that are focused beams of radiation called stereotactic radiosurgery that only hit the lesion itself and not the surrounding brain. That, of course, has advantages for not exposing the normal brain around a lesion to unwanted radiation. And there are still instances where whole brain radiation is appropriate, of course, but that stereotactic radiosurgery, that is really the gold standard for treatment of patients with even numerous brain metastases now. And that represents a shift in the last few years. And that's a good shift, frankly. So every patient will get radiation because that is the gold standard. But certain lesions now, as we realize that people are surviving longer and longer with brain metastases, that role of surgery in making radiation more effective by what we could say cytoreducing or reducing the size of that lesion by removing it, reducing the number of tumor cells that are still there, it really can impact that radiation. And so surgery plays a role there. And like we talked about, surgery really may be helpful to remove a larger lesion that radiation might not be as effective against, or that might be causing problems for the patient. If it's pushing on important structures and it's causing weakness or speech deficits or anything like that. And so as our surgical techniques improve too, we can operate in areas of the brain now that people once thought were dangerous to go into. Now, I don't recommend doing that everywhere, and I would recommend sticking to academic or experienced centers that have a lot of these advanced technologies and surgeons who specialize in this. But some of the success stories I can remember are patients that are told at various hospitals that they have inoperable brain tumors, they have weeks to live, months to live, go home, make yourself comfortable, put your affairs in order. And I just spoke to one of those folks who we took 2 lesions out of their motor strip, which were deemed inoperable at a place. And she was given, a couple months to live. We operated on her, I think it's about 3 years ago now, and she's doing just fine. So, there are plenty of success stories because the combination of surgery and radiation, when surgery is appropriate, can offer, 80, 90, 95% local control rates for breast cancer metastases in the brain, depending on those histologies, those molecular markers, et cetera. And so we have many patients surviving years following even brain metastases with no evidence of recurrent disease anywhere in their body. That's far different than what I was taught even a decade ago, where we would offer people 3 and 6 month prognoses. That's just not the case. It's inappropriate to tell people that they don't have options at this point.
Well, and I think I just want to highlight the value of getting a second opinion. I think, and especially getting a second opinion at an NCI designated cancer center can really make a huge difference. And so we'll make sure to highlight that on our website as well, because it is an invaluable thing. You just can't replicate that. You really need to make sure that you're hearing from other doctors. So I'm really glad. Thank you for sharing that.